Nellie. What's Dr. Gouda doing here? I thought our herd health checkup wasn't until next week.
Hi, Rosie. Mrs. Calloway called in because Holly started having pain, redness, and swelling in her udder, which are all symptoms of mastitis. Mastitis is important because it impacts our welfare and can be costly for our farm. So she wanted Holly to be treated right away. A few days ago, Holly was feeling a little off, but she wasn't showing any signs of mastitis. Now that she's showing symptoms, she's definitely clinical. To be safe, Mrs. Calloway wants the other cows in Holly's group to be checked as well, even if they're not showing signs of mastitis.
I remember Dr. Gouda telling Mrs. Calloway about mastitis at the last visit. He said that staphylococcal intramammary infections are an important cause of subclinical mastitis, and that it's very common on dairy farms across Canada. Sometimes these infections can stick around for a long time. Well, do you remember when Sunshine had it last year? Her somatic cell count went way up, and her production really dropped.
Yep, usually a high SCC tells us that a cow has a case of mastitis, but that doesn't tell us what is causing the problem. Dr. Gouda was just telling Mrs. Calloway about an analysis tool called Matrix-Assisted Laser Desorption Ionization Time-of-Flight Mass Spectrometry. Phew, that's a mouthful. I think they just say MALDI-TOF for short. Apparently, MALDI-TOF analysis can tell us which species of microorganisms are present in a milk sample. It's also accurate, fast, and cost-effective, which is important for being able to quickly treat the problem.
Wow, that's pretty cool. So now they'll take a sample of Holly's milk and the milk from the other cows in her group and test it using the MALDI-TOF analysis?
That's right. Using MALDI-TOF, they'll be able to look at the milk samples and tell us which microorganisms they find.
What about the cows without any symptoms? Will the MALDI-TOF be able to detect anything in those samples?
Yes. If microorganisms are present, the MALDI-TOF analysis will tell us which ones they are, even in milk samples from cows that look healthy. Dr. Gouda explained that a recent study used MALDI-TOF to identify common species of microorganisms in samples from sick cows and cows that looked healthy. Overall, they found 294 different species of microorganisms. They also saw that the most commonly found species were different in cows with clinical mastitis and cows that were apparently healthy.
That's pretty cool. Oh, but Holly's a first lactation heifer. Do you think her results will be different from cows who are in their second or third lactation?
Good question. Researchers also found that these 5 staphylococcal species were commonly found in first lactation heifers with intramammary infections.
That's interesting. Well, I also heard that a few species were more likely to stick around over the dry period than the others, like Staphylococcus aureus, Staphylococcus psilocys, Staphylococcus chromogenus, Staphylococcus simulans, and Staphylococcus epidermidis.
That's right, Rosie, but it isn't always doom and gloom. Some microorganisms aren't necessarily harmful. In fact, some can even be beneficial. So it's important that we recognize which ones to look out for.
How do we know which ones will be harmful? I overheard Dr. Gouda telling Mrs. Calloway that there isn't a lot of information on many of the species that can be identified in our milk samples.
Research is continuing to help farmers, veterinarians, and scientists better understand which species will be harmful and which ones are not. It's important to look out for the species I mentioned earlier, since those were the most common.
That's really good to know. I'm glad Mrs. Calloway and Dr. Gouda are working together to help Holly recover. I'm sure they'll come up with some strong prevention strategies to keep the rest of our herd healthy and free from infection.
Well, I'm glad we now have a treatment plan for Holly. I'll send these milk samples to the lab and we'll let you know what we find. In the meantime, it's best that you implement some mastitis prevention strategies on your farm.
We're already wearing gloves for milking, using a pre- and post-milking teat disinfection, and routinely maintaining our milking equipment. What else can we do to prevent mastitis?
Those are all great practices. You can also check any new cows before mixing her with the milking herd, segregate any cows that are chronically infected, look at increasing the bedding depth in your stalls, and consider using sand bedding instead of rubber mats or mattresses. Teat sealants at dry-off are also a great option for preventing new infection during the dry period. We will also continue to do scheduled milk testing in this herd so we know how many cows are impacted and where the mastitis is coming from.
That all sounds pretty manageable, Dr. Gouda. Thank you for your help.